Hi there. Welcome to my channel. Let's talk about something important in women but often overlooked. Vaginal discharge is a natural and essential part of the female reproductive system. It helps cleanse the vagina, prevent infections, and maintain a healthy balance of bacteria and vaginal pH. While vaginal discharge is normal, changes in its amount, color, odor, or consistency can indicate underlying health issues, including vaginal discharge syndrome. What is normal vaginal discharge? Normal discharge is produced by glands in the cervix and vaginal walls. It typically consists of water, cervical mucus, vaginal cells, and beneficial bacteria, mainly lactobacillus species. So, what does it look like? Normal discharge is usually clear, white, or slightly yellow when dry. It doesn't have a strong smell, and consistency varies from thin and watery to stretchy or creamy, depending on the menstrual cycle. Amount is typically 1 to 4 milliliters daily. No associated symptoms. No itching, burning, pain, or irritation. You might see more discharge around ovulation, when you're pregnant, or when you're sexually aroused. You might see less after your period, or during menopause. All of these are completely normal. Now, let's break it down by phases of the cycle. After menstruation, expect minimal discharge or dryness till close to ovulation, that is day 10 to 14, when it should be clear, stretchy, with egg-white consistency. This indicates high fertility. After ovulation, it becomes thicker, white or creamy. Before menstruation, may increase slightly, with a thicker consistency. During pregnancy, you may experience increased discharge due to hormonal changes. At menopause, decrease in discharge is expected due to lower estrogen levels. But when should you be worried? Watch out for a bad smell, especially fishy or foul smell, a green, gray, or yellow color, thick, curd-like, foamy, or unusually watery texture. Or symptoms like itching, burning, or pain during sex or while urinating. These signs might mean an infection. Let's go over a few common causes. 1. Bacterial vaginosis causes thin gray discharge with a fishy smell. 2. Yeast infections cause thick white discharge and itching. 3. Trichomoniasis, a sexually transmitted infection, causes frothy green or yellow discharge. Other STIs like chlamydia or gonorrhea can also change your discharge. These conditions fall under what doctors call vaginal discharge syndrome. It is a clinical term referring to a combination of symptoms which includes abnormal discharge, odor, irritation, or discomfort often caused by infections. Diagnosis is through physical exam, lab tests, and vaginal swabs. Treatment is based on cause and may include antibiotics, antifungals, or antiparasitics. Partner treatment and safe sex practices may be recommended. Another important factor in vaginal infection is douching. Douching refers to the process of washing or cleaning out the vagina with water or a mixture of fluids, often scented or medicated. This practice is commonly marketed as a way to maintain hygiene, eliminate odors, or prevent infections. However, medical experts strongly advise against routine douching. The vagina is a self-cleaning organ. It maintains a natural balance of good bacteria and acidic pH that protects against infections. Douching disrupts this balance by washing away beneficial bacteria, increasing the risk of bacterial vaginosis, yeast infections, and pelvic inflammatory disease, PID. It may also contribute to complications in pregnancy, such as ectopic pregnancy and preterm birth. Despite widespread marketing, there is no scientific evidence that douching improves vaginal health or cleanliness. In fact, it can mask symptoms of infections, delaying diagnosis and proper treatment. Health professionals recommend avoiding douching entirely. Instead, washing the external genital area, vulva, with warm water and mild soap is sufficient for hygiene. Education on normal vaginal function and promoting body confidence can help reduce reliance on harmful practices like douching. So, when should you see a doctor? If you notice a sudden change in color, smell, or quantity of your discharge. If there's itching, burning, or discomfort. Or if there's bleeding between periods or after sex. Please get checked. Conclusion. Understanding what is normal and what isn't in vaginal discharge is key to early detection of infections and maintaining reproductive health. While normal discharge varies across the cycle, any persistent or unusual changes should prompt medical attention. Vaginal discharge syndrome is a manageable condition once accurately diagnosed. Open conversations and awareness help women take proactive steps in monitoring their vaginal health. Remember, except around ovulation, when pregnant, or when sexually aroused, you shouldn't see any significant vaginal discharge. Also, on no account should it have a bad smell. Stay informed and take care of your health. Thanks for listening. Please like and subscribe for more educational contents.